Hi, my name is Gabrielle de Rosa. I'm an MHA student, so I'm getting my master's in healthcare administration at the UNLV School of Public Health. I was always drawn to healthcare. I initially thought I wanted to be a healthcare provider, whether that be a nurse or a doctor. And so I got my undergraduate degree in biology thinking that I would eventually go to some kind of medical school. But during that time, I did find that I was more drawn to kind of the business side of healthcare. And so that's when I found healthcare administration and understood how flexible an MHA degree is. And so that's why I ultimately decided to pursue my MHA with UNLV. To be just an Anthem Scholar in general is honestly a very big honor for me because it tells me that, I'm recognized for the work that I'm doing within my time at UNLV. But to be within the first cohort is really inspiring because I'm able to tell others that I meet along the way, whether they're, undergraduate or graduate students that I connect with throughout my time here, that these are opportunities that, they should pursue when they choose their internship as well. So my internship was with the UNLV School of Medicine, and I worked in the Office of Compliance alongside one of my other students in the cohort, Janin. So we both worked at the Office of Compliance and we standardized their GME handbook. And so we had to review over 20 specialty handbooks and understand their policies and procedures and create just one standardized GME handbook that the students can utilize during their time in the GME program. And so it really allowed us to understand compliance. It's something that I never got experience with prior to my internship, and really the importance of being clear in policy making and the importance of, having a standardized process so that your employees, students, wherever you're working in compliance are, following their expectations and have a clear understanding of what's expected to them prior to starting their position. I definitely see myself pursuing a career in healthcare operations. I'm currently working in healthcare operations now, and I find that that's where I just thrive the most. And so post-graduation, I did accept an offer to do an administrative fellowship. And so that's really going to allow me to, again, gain more experience within multiple sides of healthcare and, ultimately help me in pursuing a career as a healthcare operations executive. Don't underestimate the experience that you have and how it can translate into your career in healthcare. Prior to me coming into the MHA program, I did not have any healthcare experience, and I was really down on myself and really just feeling like I needed to catch up. But I did find that, my previous job experience, while it wasn't in a traditional healthcare setting, it allowed me to understand leadership and understand, management, and that can translate into any career within public health and healthcare administration. So I definitely would say, take any opportunity you can get and take a learning lesson from any experience, whether that be within school or within work, and don't underestimate the experience that you already have, and really just be open to learning multiple sides of healthcare because they ultimately all flow into each other to create, a seamless and well-maintained healthcare organization or public health organization. When I ultimately decided to pursue my MHA with UNLV, it really came down to the connections I was expecting to build within my cohort and within our local healthcare community, and that definitely did not disappoint. I chose UNLV because I really wanted to be able to build strong connections with other students in my cohort, and those are ultimately the future healthcare leaders of our community. And so I wanted to build those connections. And I know that they have really strong connections with ACHE and other local healthcare chapters. And that's ultimately what I was looking for, to be able to learn from those who are operating the healthcare system within our community right now. And that's definitely something that I really worked towards. I went out and pursued these opportunities. I'm also in HCASA, which has been a really big part of my experience at UNLV. I built connections with both undergraduate and graduate students, and through that I was able to find a mentor and also kind of become a mentor for others who are potentially looking to pursue the MHA degree. So I definitely think the sense of community that the School of Public Health has is something that I couldn't get anywhere else.